Okay. Hi, Elizabeth Young Consulting. Hi, everybody. It is a rainy Thursday. It's a rainy Thursday here in Los Angeles, the city of angels. It's raining. I wanted to start a little bit early just to check in with everybody to see how they're doing. We're always scheduled to start at 2 o'clock with our guests, but I like to step in a little bit early to check in to see how everybody's doing. So maybe in the comments you could let me know you're doing okay. L.A. Hermanson, so happy to see you. Maria, so happy to see you. Thank you for coming. Baker 06K, hi from Nashville. It's beautiful there. I'm glad. Raining in Ohio. So I appreciate all of you, some of you who have come before to join us on Home Together, some who are maybe coming for the very first time. Mama Baumann, hi from Austin. Oh, Sela Jardine, hi from Australia. Wow, that's wonderful. PW Wit 5, these Instagrams are so great. Thank you so much for saying that. I really appreciate that. The whole focus of these Instagrams, which we are calling Home Together, the focus is to bring you the helpers, the healers, the cultivators of hope. The focus is to bring you 10-15 minutes of inspiration, 10-15 minutes of information that can move you, inspire you, motivate you, and make you feel a little less alone and make you realize that we're in this together. Hi from Chicago. Love watching this every day. That's awesome. Patrick, my co-anchor, is not going to join us today because, Maura Corrutulo said, I just got home from the hospital. I'm a nurse. Let's all collectively thank her so much for her extraordinary work, just getting home from the hospital, a nurse. I would love to have you on here because I'd love to talk to you about what that's like. One of the questions that somebody had on my Instagram was to ask Vann about the nurses in Detroit who said that they didn't want to go to work anymore until they got sufficient support. So I would love to talk to some nurses on here. Anyway, thank you when they said watching Pastor Max Lucado. Today, why Patrick is not on here, he had a previous long-standing commitment on his site to do a happy hour with Hampton Water and a friend who had started that company. It's a small business, and so he's over there. And I told him that before he goes over there, he has to come over here to make sure I bring Van Jones on properly. And I'm really happy that today we're going to welcome Van Jones onto Home Together. Why am I happy about that? Let me tell you. I'm happy about it because Van is a good human being, first and foremost. He's a great political commentator. He's an author. He's an activist. He's an advocate. And he is sounding the alarm in particular to the Black community about the health disparities that exist in the Black community, about what they should be paying attention to with COVID, and why that might be in particular a little bit different in that community compared to some other communities, different in the Latino community, the Caucasian community, also depending on your age. He also is the CEO of Reform Alliance, which is working so hard to reform our criminal justice system. And we can also talk a little bit of politics with him. So we can talk to him about so many different things. And I love people like that we can talk to so many, we can talk about so many different subjects with one person who's so well versed. Oh, Patrick is back to help me momentarily. I explained to everybody, this is my son, Patrick Schwarzenegger. And I just explained, we always do this Home Together, but just like in the real news, sometimes co-anchors have to go off and cover another subject, and you're covering another subject today.
Yes, I'm doing another thing with the Bon Jovis.
Yes.
That was part of our
well, he came on here, and he said, I'd love to come on Home Together if Patrick would come on my son's account. he didn't ask us both to come on that account because they only want young, hip people
Yes.
on the Hampton Water account. They don't want people probably
All
my
good.
age.
But I'm
All
sad
good.
because I wanted to talk with Vann Jones, but I will be able to watch this live afterwards. And
You'll be able to watch it taped.
Yes, taped.
On where?
YouTube.
Okay.
But in the meantime, I will wait so that you can, because I'm the technical person here. And
Mimi Gasol, you have an important question for Vann, so you should tell us what the important question is, because I don't think I'm going to be able to manage the question thing here.
it's fine. I mean, all you have to do is
without
click
Vann.
this little
I mean-
question section if you want to see question,
Oh,
but you also don't have to.
okay.
Doesn't matter.
Steve Later saying hi, happy Easter. Pastor Later did a beautiful. Wow, turn that off.
Okay.
Second, please. Pastor Later did a great sermon on Sunday on the Sunday paper
But
account.
just so I can show you what you do,
Okay,
you
well,
press
just
view.
say hi to.
I'm just saying, you press view,
Okay.
and then his request will come in here.
Okay. Well, we don't. He's not
He's
here
not
yet.
here yet. He's not here
Okay.
yet. But I'm just saying.
Well,
So
don't leave until he's here, because I
Okay.
don't want to mess it up.
All right.
Vann Jones is very busy on CNN. That is a competing network to where I work. I work at NBC News. But anyway, glad I got all that explained. Anyway, Vann is going to talk about his kind of call to the African American. Oh, Patrick, sweetheart,
Sorry.
could you turn your audio down? Oh, okay. Anyway, he's going to talk about his call to the African American community. He's also going to talk about the work he's doing with Reform Alliance in prisons and reforming the criminal justice system. And then I want to talk to him about his take on Bernie Sanders. I wrote, oh, there it says, Vann Jones is trying to get on here, Patrick. Okay, Vann Jones, hello. Hello, Vann. Okay, we're coming, Vann.
We're coming. We are
coming.
coming. We are
Okay.
coming. We are coming. Let's say hi and then bye.
Oh, you can't say hi and bye to Vann Jones.
Just
There.
for our purposes.
Hi, how are you?
Hi, Vann. How are you?
I am good. I'm good. I am safe. I am supplied, and I am symptom free. So those are the three things you gotta check for every day. I'm winning on all three accounts so far. Thank goodness.
That's good. You're one of the lucky ones and the blessed ones. Patrick is normally my co-anchor, but
What's going on, man?
this is my son, Patrick.
Good to see you.
Jones.
Yes, of course, I know.
And but he has a previous commitment, so he's going to cover a different story and leave me here alone with you.
Well,
But,
I think we'll be all right.
yeah, we'll be for sure. We'll be all right. So, Vann, thank you so much for joining us today on this Home Together series. And we've been having all kinds of people on here who've been helping, who've been providing healing information, and who are really, as I say, cultivators of hope. And I was super excited, as I said to everybody today, to have you on here because I believe you're all three of those things.
Thank you.
And so I think the work you've been doing with the Reform Alliance, as I just told people, that is your organization that works to reform the criminal justice system. And so I want to talk about that. And I want to also talk about your call yesterday, really out there to the Black community to pay attention to this disease. So talk a little bit about that, Vann, and why you think they weren't paying attention and what they need to pay attention to that perhaps is different than other communities.
Well, I think that we haven't done a good enough job of saying to the Black community in particular that this is an epidemic jumping on top of other epidemics. We already have epidemic levels of hypertension, high blood pressure in the Black community. As you know, with this virus, that can be fatal. People with high blood pressure do not do well with this virus. We already have epidemic levels of obesity. Asthma is a huge problem. You know, how many Black kids have inhalers? Also, diabetes and prediabetes. All of these are what they call comorbidities.
Yeah.
Nobody knows what a comorbidity is. Like, you talk to, people in the community, well, I don't have comorbidity. I don't even know what that is. Well, so we've got to start telling people, if you have to take pills every day, you are in great danger. You're seeing Black people dying in their 50s, in their 40s, in their 30s, and in their 20s. So nobody's saying, hey, you got a 27-year-old nephew with an inhaler? That young man could be dead next week. We have to speak in those kinds of terms. And if you don't speak in those kind of terms, also, Black people, we refer to diabetes as sugar. I got that sugar. Well, you got to say to your nephew, your niece, your aunt, hey, you got sugar. Don't go outside. You're going to get in trouble. Or pressure. We don't say hypertension. We say pressure. You have to understand the culture and tell people in terms they can understand. Otherwise, people are going to be taking risks they shouldn't take. Easter's coming up, and a lot of people still want to go to church on Easter. And you have to say, no, that's not what is wise to do.
I'm so glad to hear you talking about these pre-existing conditions, because as you probably know, I work in the Alzheimer's space, and we're always trying to sound this clarion call really to the African-American community about hypertension, about diabetes, which puts you on a fast track to dementia and Alzheimer's. And as Dr. Fauci said yesterday, it's not that COVID-19 is picking out people of African-American descent, but it is because of those pre-existing conditions that makes them more vulnerable. And it is also, this disease is shining a light on our health disparities that existed before this. So what is your hope coming out of this? And how are you going to get people to listen?
Well, I'm talking to you, I'm talking to other people, and we are in the same business. We're trying to get people bad news now so they can have good news later. It's the toughest business in the world to tell you, hey, listen, what you're doing right now is bad, but if you change, you'll have good news later. But that's where we are. And we use these terms, like health disparities and that type of stuff. That's very good and polite conversation. What we really are trying to say is that the healthcare system treats African Americans very poorly. We are underinsured and barely, sometimes underemployed and barely healthy. And often, unfortunately, doctors, they don't give us the same attention, et cetera. All these little small things add up, and suddenly you have a community that's much sicker. The Black community is much sicker. Our health is much poorer on a daily basis. And so, therefore, when an epidemic comes, a pandemic comes, we have to be super vigilant. Somebody got mad at me. They said, Dan Jones, you're making Black people look bad. You're making it seem like we're the only people out here who are stupid. You got white governors that are making terrible decisions in the South. Why aren't you attacking them? I said, listen, I've called them out, but I'm trying to call us up to a higher level of vigilance because we have much more at stake. And so it's not that there's something, like you said, the virus is grabbing everybody, but we do have this long history of discrimination that does show up, unfortunately, in the doctor's office sometimes, and that has left us much more vulnerable.
When you say call us up, you have a call out, really, and I want to talk a little bit about that. You're calling up and calling out Black preachers. You're calling them up just to close down their churches, but also to open up their churches for a different reason. Talk a little bit about this safer plan you have and how you feel you're calling people up to a different place than what they normally do.
Well, listen, I tell you, the Black church is the pillar of our community. People don't understand. People, whenever you talk about Black voters, they talk about Black church. Whenever you talk about the Democratic Party, they talk about Black church. You don't talk about the Irish church and that kind of stuff. Even though the Catholic Church has played such a massive role in your community, but you don't talk about it in the same way. Why is that? It's because for so long it was the only institution under segregation that we were allowed to have. And so it has such deep, deep roots and power. And what we're saying is, please, ministers, tell your congregation, celebrate Easter at home. # Easter at home. It's not safe. It's not wise. There are other ways to deal with it. But since these churches should be empty anyway, open up the doors of the church to people who need to be able to shelter someplace. We want people who are in prisons to be able to come out, especially older people, sick people, people in for minor violations, people who haven't been convicted, they're just waiting, they don't have enough bail money, people on little probation violations and parole violations. Any little petty minor arrest can be a death sentence right now. So we're calling on all 50 governors and departments of correction to have compassionate release for the sick who are in jail, for the elderly who are in jail, which are a lot of them, And also, when they say, well, where are they going to go, etc., let the churches volunteer to say, we will let them shelter in place here. We'll let them self-quarantine here for 14 days. If you're concerned about somebody, maybe you put an ankle bracelet on them or something like that. But it'd be much, much better to, reduce the overcrowded prison population by 20, 30% safely, smartly, intelligently, than to have a pandemic rip through our prisons and
So
create.
I want to know how that message is being received by the pastors in particular, not just the Easter stay at home part of it for services, but the call to them to open up their churches to be home, really, for people who are in prison. Because you're really calling two different things out. You're calling for release, compassionate release, and you're calling on churches to open their doors to those released.
Yes. Well, I will have numbers for you soon. Reverend Al Sharpton, Roland Martin, the great journalists, have been leading the charge on this call. I'll have to ask them, how things are going. But what I will say is this. If we don't have compassionate release, the prisons can become morgues from coast to coast.
Mm-hmm.
We have 2.4 million people who are in prison right now. The biggest prison population in the world. A quarter of all prisoners in the world are here in the United States. All of them are sitting ducks for this virus. They can't social isolate. They can't wash their hands. Sanitizer has alcohol in it, so it's contraband. There are no respirators in prisons. And the virus spreads at 7 to 15 times the rate in a prison environment than a normal environment. So you could have 100,000, 200,000 deaths in our prisons, over the next month. That would be just an unbelievable catastrophe. Trump said we might have 200,000 deaths. You might have that many in the prisons alone if you don't do something. And so people say, well, we don't want axe murderers and rapists. And if you don't understand, the prison population in the United States has a lot of people. Those people need to be protected. Nobody was sentenced to die from a virus in our prisons. So everybody needs to be protected. But there's a lot of people in prison for nonviolent drug charges and other stuff that really could be safely brought home, put to home confinement, and then brought back when the pandemic is over.
So I know I saw in, I think it was a CNN interview maybe yesterday where you were saying that some people say to you, look at, this is not my issue, people in prison. I don't really care about this. And you responded with, you should care about this because not only will this be a pandemic in the prisons, it will infect guards. It will have far-reaching consequences that will impact you. So for people who are feeling out there like, God, I'm staying at home. I just lost my job. My life
Right.
is, now you're telling me I should care about people in prison. Let me turn you off. So how do you turn them on?
Well, listen, there are two things. One is, of course, anybody can wind up in prison or jail at any time. If you run a stop sign, you have no idea, so you can't write off that whole population. But I will say this. A prison or jail can be a super accelerator of the virus. You cannot beat the virus outside the prison, have 2.4 million people with the virus in the prison, and then have guards and staff and cooks going in and out of the prison without reinfecting. And so then, you bring the virus in as a guard or you take it out as a guard. That revolving door means you've got a big, big problem. And nobody's talking about this.
Yeah.
If, in fact, those 2.4 million people get sick, they flood into our hospitals, and then you knock out the hospitals because you don't have 2.4 million ICU beds. You barely have 30,000 ICU beds in the whole country. And so you really want to get ahead of this problem. If you want to be able to go to the doctor yourself, if you want to be able to beat the virus yourself in your own neighborhood for your own kids and for your own protection, this actually needs to move up on the priorities, because this is going to be where you have the real breakdown that makes everything worse.
A lot of comments on here thanking you for talking openly about this. Both of these kind of parallel conversations in a way that you're having here, a call out to the Black community, a call up to the pastors, a call out to the entire country about prisons, about compassionate release, about opening the doors. They're tough subjects in a good time, right? They're complicated, controversial, emotional in a good moment. Are you finding people more compassionate in a way to this? Or are you finding it like, not now, Vann, come on, not now?
You know, there's a mix, but I think there's a doorway to something else now. We made some mistakes in our society. We started believing stuff that wasn't true. We started believing that people could make a lot of money, like I have, like you have, that we could kind of get in a gated community, that we could send our kids to private schools, that we could do all these great things. And, you know, whatever's going on in the poor part of town, you know, God bless them. I hope they study hard. I hope they stay off drugs. Hope they work hard. Hope they make it. But that's not my problem. I'm over here. I'm separate. And guess what? This virus has taught us there's a poor, low-income woman of color that's going to take care of your kids. And if she's sick, you're in trouble. If her wages aren't good, you're in trouble. There's a person of color that's going to bring the package to your house often, standing in those grocery stores, making $12 an hour, $15 an hour. You couldn't pay me $1,000 an hour to stand out there in those grocery stores right now. It turns out we need each other. It turns out we're connected. It turns out that compassion is actually smart, because making sure they've got health care and good jobs and protection keeps me safe. Mm-hmm. And because we forgot about that, we did not build a health care system to take care of everybody. Because we forgot about that, we don't have a family leave policy. So if somebody needs to quarantine at home, they can protect their jobs. Because we forgot that we need each other, we wound up in a situation where all of those moral failings that we were able to brush under the rug, like you said, in the good times, now the bills are coming due in the bad times. And so what we've got a society right now with an awful lot of data, but very little wisdom. See, these devices in our hands, a lot of data, a lot of algorithms, but very little wisdom. There's a moment now for wisdom. It's not just compassionate to help folks. It's actually wise to help folks, because we're all connected.
I think this is a moment for empathy. It's a moment for collaboration. It's a moment for the recognition, as you say, that we're one. You talk about many of the issues you just talked about. You also wrote, I followed on your Twitter yesterday, that you thought Bernie Sanders would be viewed as someone who was ahead of his time in time. That yes. These were many of the issues that you just talked about that he talked about. Yes. So talk a minute about that. Those issues took hold, but not on the scale, perhaps, that he would have wanted, and that those who followed him would have wanted. And how do they become front and center in Joe Biden's campaign?
You know, it's very interesting, because I never endorsed candidates. I didn't endorse Bernie or Hillary or Kamala or any of them. I just try and look at it objectively. Mm-hmm. People saw Bernie as a throwback. He's the old guy, talking about the 60s idealism. You know, he's kind of, that's where he's from. And for some reason, the kids like this kind of retro stuff, and that's kind of the whole deal. But it turns out that's not true. Yes, he's inspired by the 60s, but his ideas wind up looking a lot more tough-minded and realistic for this lethal 21st century. When he says healthcare for everybody, that doesn't sound crazy today. You want that person standing on the street corner to be able to go see a doctor right now, get a test for free right now, and get help right now. You don't want them to have to go and earn $1 million to be able to get on a respirator. You want them to have a respirator right now. That's healthcare for everybody. How you design it, different question. But that idea is, in the age of the pandemic, is pretty smart. Housing for people. You don't want a homeless population and homeless encampments in the age of the virus. Family leave. All these issues that seem like idealistic, pie in the sky, 1960s throwback ideas turn out to be pretty hard-headed and realistic for the new century. You know, my problem with Bernie was he was just so tough on rich folks that even if you agreed with some of his values, if you had any money, you couldn't support him. So I wish that he had been, been a little bit more discriminating. Some folks who have money are, on the side of good, and some are just trying to rip folks off. I thought that hurt him. It made it harder for people who might have sympathized with his argument to feel that they were not going to be victimized by him in power. That said, Biden has to learn, and all Democrats have to learn, that there are people who are really hurting and uncertain. And they were hurting and uncertain before the pandemic, before the plague, before the virus. And passion for solving problems. You don't have to do it the way Bernie does it. But just going back to normal and saying that Trump sucks and that type of stuff, that's not going to get people willing now to risk their lives standing in lines next to somebody who might be coughing to go and vote. You got to tell me why it's worth me to risk my life to vote now. You got to tell me why it's worth for me to even just to lick a stamp. I don't know what's on that stamp. You got people. It's a higher bar now, and I think Biden needs to find a way. I love his passion for ordinary people, his compassion for ordinary people, but I need to see more passion for real solutions.
You know, Vann, so many people are saying to me this past week, who do you think first of all, when is this going to be over? And what's going to happen to us, and who will we be? Who will we be when we come out of this? And I believe that we're going to be different coming out of this. And people say like, we'll be different for a week or two, but then we'll go right back to where we were. That's what happened after 9/11. People went back. And I don't believe that that's going to be the case this time around. We're coming out of this into an election. We went into this very divided, very angry. And I do believe we're going to come out differently. Do you?
I do. And, breakdowns can lead to breakthroughs if you use them right. Mm-hmm. This is a big breakdown. This is not just the federal government, I think, failing to get out ahead of this. There's a lot of bills coming due, from our healthcare system, from, our distance from each other, our not believing and investing in our lower skilled, lower wage workers. There's a lot that's coming due. But, what is the next normal going to be? That's the question we have to start asking right now. What do we want it to be? Mm-hmm. This is 9/11 everywhere. This is not 9/11 in New York.
Right.
This is not Katrina in New Orleans. This is 9/11 and Katrina everywhere, in every neighborhood.
Exactly.
And coming out of it, some people are going to be more guarded, more suspicious, more me, myself, and I. But there's also going to be people who are going to be like, hey, listen, we can't get through this on our own. We need a government that works. We need communities that work. We need to really understand that we are connected. And I think the audience for fear will be bigger, but the audience for hope will also be bigger. The argument for division will be bigger, but the audience for unity will also be bigger. And what I've noticed is the dividers have seemed a lot more self-confident before the plague, before this pandemic. I don't hear the divisive rhetoric as much. I think the unifiers and the bridge builders have been a little bit more timid before the plague. Yeah. I think we're starting to speak out a little bit more boldly now. And so I think that, breakdowns can become breakthroughs if you use them right. But it's not foretold. It's going to have to be fought for. But there is a better tomorrow out there for us if we fight for it.
Couldn't agree more. Talk a little bit, Vann, about how people can get involved in helping you with the Reform Alliance, the work you're doing, kind of what I call on the front lines. How can people support you, help you, get involved, and why?
Look, I could not be prouder than I am to be a part of the Reform Alliance. It was started by Jay-Z and Meek Mill and Michael Rubin and Robert Smith and Robert Kraft and Clara Wu Tsai and Michael Novogratz and Dan Loeb, and then and also by Laura Arnold. These are basically 8 billionaires plus Meek Mill, who maybe someday will be a billionaire. And they all said we want to do something about the criminal justice system. This is before the plague, before the pandemic. Too many people going in and out of prison. They were concerned about probation and parole just being a revolving door and just throwing people back inside, even though they're not committing new crimes. That group of people has stuck together. And when this pandemic hit, leaned forward, including our staff, Jessica Jackson, in particular, Bob Pylon and others, to do something to make sure that people weren't being sent back into plague-infested prisons. And then, frankly, to get people out of those plague-infested prisons and to get masks in. We got 130,000 masks into prisons, Rikers Island, Mississippi, and Tennessee, more on the way, and to help people when they come home. And Shaka Senghor, the great author, friend of Oprah Winfrey's, who did time in prison, helped to lead the charge on that. And what you're seeing is just people stepping up and saying, don't put people in prison when they might die, if it's for some minor thing. get people out, send in medical supplies, help people come home. And I'm just so proud. So reformalliance.com is the way to help us. You can follow us at Reform on all social media. You can follow me at Van Jones 68 on all social media. But reformalliance.com is how you can help us.
And Reform Alliance was doing this work before. They have shifted their message a bit in this pandemic to focus on the issues that Vann has been talking about. And I think a couple of people on my Instagram said, you know, oh, you're playing the race card. And I said, no, I'm playing the humanity card. And I think that it's really a chance for all of us. I think what Vann, really, you've been saying is that we're all in this together. This isn't 9/11. This isn't Katrina. This knows no, you know, racial divide, although, as you say, you talk about pre-existing conditions, but this is an opportunity for all of us to look at our fellow brother, sister anew, right?
Yes, absolutely. And here's the deal. The Reform Alliance is every color in the Skittles bag. I mean, we literally have every color of person in the rainbow in the organization. The thing is that there's nothing wrong with pointing to facts, even if they're uncomfortable. Facts aren't race cards. They're just facts. It's just the fact that African Americans have way worse health, in part, studies have shown, because the healthcare system does discriminate all too often. As a result, we now need to be rushing respirators into the Black community because that's where people are dying the most. That's just a fact. It's not playing the race card. If it turned out that left-handed people were dying in larger numbers, we've got to figure out where the left-handed people are. So let's not let our desire to not be racist prevent us from being racially just when there's a racial imbalance in our country.
Amen. Well, Van Jones, thank you so much. Let's reiterate that again, reformalliance.com, not .org.
Not .org, reformalliance.com.
.com. You can go on Van's Twitter feed and actually see, you could read the op-ed he wrote about this. You can see some interviews he's done on CNN about this. Obviously, you can follow him for his political commentary, but his call really to Black churches, really his call to all of us who might have a pre-existing condition, and they're more accentuated perhaps in the African American community that might make them more vulnerable. As I always say in the Alzheimer's fight as well, people in the African American community twice as likely to get Alzheimer's because of pre-existing conditions. These are, when Dr. Fauci says that he hopes this will focus us coming out on these health disparities, do you think it will?
It can. You know, it's in our hands. It's in our hands. Yeah. I think it's going to be hard to ignore. Unfortunately, you know, we always say, you know, after 9/11, let's not let those people have died in vain. You know, we'll take our shoes off in the airports. We will do all these things 20 years later. You know, the same with any other, you know, mass event. If this many people lose their lives, let's be more prepared next time for the next pandemic. There will be others. And let's also make sure that you're only going to be as strong as a country in a pandemic as your most vulnerable communities. And so it's smart to invest in the health and the well-being of the people at the bottom. It will keep us all a lot safer and a lot healthier. And if that can come out of this, then we can save a lot of lives the next time and also get rid of some of these imbalances in the meantime.
Van Jones, thank you so much. reformalliance.com. And you can follow Vann, who I know is super busy. So I'm going to let you go. And thank you for your extraordinary work.
Well, thank you.
I always watch you, and great job.
And so do you. And thank you for your great work. You've always been a massive humanitarian, and your family, of course. America wouldn't be America without your family. So thank you for having me on.
Thank you, Vann. God bless you.
Very good.
Okay. So I'm going to tell Vann, oh, bye. Van Jones left. No, I want to, oh, there, okay. Patrick normally does that. So really great discussion. I want to thank Van Jones, remind you that that's called the reformalliance.com. There's a great many people working on that initiative. And I think he said a lot of very moving things. I think making us all aware about pre-existing conditions. And certain people in the African American community have a lot more pre-existing conditions or have different pre-existing conditions. This is a chance for all of our brothers and sisters who are on ventilators, who are fighting for their lives. Let us not make that in vain. There will be things we can all do when we come out of this that will make other people's lives better. And so I think many of his points there were really thought-provoking, inspiring. We'll watch this interview. It's going to be on YouTube. So if you want to watch it again, you can. Obviously you can follow Vann, but I think so many of the things he said are really apply to us all. Stay home. I always like to say that staying home is an act of service. I get frustrated with it. I know you're frustrated with it, but it is our act of service. And we're all in this together. And so while the doctors and the nurses and the healthcare workers are doing the kind of lion's share of the work, we're also helping them by staying at home. It is our national service. It's what we can do. So don't think staying at home is in vain. Don't think staying at home is nothing. Don't think staying at home is ridiculous. It's an act of service, and it is helping each state flatten the curve. It's helping our doctors and nurses who are working round the clock to save the lives of those we love, those we don't even know. And so I want to thank Vann for sounding the alarm the way he has. I want to thank him for his work, using his voice. Once again, this conversation series is about the helpers, the healers, the cultivators of hope. If you have ideas for who we should be interviewing, let me know. There's a question here, how much longer do people have to stay at home? I don't know. And our leaders have said they don't know either, and that they will tell us when they feel they have a handle on this situation. So living in the unknown is difficult. Living without the answer is difficult. Living with the uncertain is difficult. And so every day I know all of us have to get up and live with this. I don't know. I don't know when I can go back to work. I don't know when I can leave my home. And that's hard, I know, but it is what we are all having to do at this point in time. We are having to live in the unknown, follow the rules, pay attention to what we're being told, and follow what we're being told. That's difficult for a lot of us to do what we're told. But we're doing it not for ourselves, but we're doing it for others. And when we do things for others, they become a little bit easier to do ourselves. At least that's the way I was brought up, and that's the way I kind of think about it. If I'm doing this for somebody else and myself and my family, it makes it more worthwhile. So I want to thank all of you for joining us. Thank you, Oliver, for saying I like the pictures in the background. Those are my kids when they were little, and they sit with me every day. I like looking at images that are frozen in time. They just take me back to maybe a simpler time. And yes, I should bring on Chelsea Handler. You're right. I love Chelsea. She's a good friend. And she's doing the To Be column in the Sunday paper this week. Every week in the Sunday paper, we ask somebody to write their to-be list, not their to-do list, their to-be list. And it's very different. She's doing her to-be list. It's actually funny and good. And as she's a funny and good person. John Krasinski, yeah. I asked my son-in-law to book John Krasinski for me. Yep, I did. And he's still on that, I think, but he has not come through yet. So I have to get back on my son-in-law to book John Krasinski. So anybody here who can book for me, come on. We're all in this together. So anyway, thank you all so much. Patrick will be back tomorrow. We're going to talk to the former Surgeon General Vivek Murthy about loneliness, about using his voice on the issue of loneliness. And I think all of us at some point have felt lonely and might be feeling really lonely right now. And so I'm hopeful that that conversation will be comforting and inspiring and, you know, I think mainly comforting, I hope. So a lot of really good suggestions in here. Andrew Cuomo, yes. Ryan Reynolds, yes. Lady Gaga, yes. So if you know any of these people, I don't know Ryan Reynolds. I met him at a restaurant once. I fangirled him before he was literally like Ryan Reynolds. But if you know Ryan Reynolds, or we can start a petition to get Ryan Reynolds on here. The nurse would be a great interview. You're right. Where is the nurse? Oprah, you're right. Obama, you're right. These are all really good suggestions. Chris Cuomo, you're right. You're right, all you people. E. Kane, Canardo, Kitty Catch, 14 Jane, Rita and Tom, you're right. You're right, you're right. Brad and Kimberly Paisley, I work a lot with them in the Alzheimer's space. And speaking of that, if you are interested in that space, I hope you'll take a minute to follow the Women's Alzheimer's Movement, which is working kind of day in, day out to find out why women disproportionately are impacted by Alzheimer's. And so that's what that organization is doing. Father James Martin, I love that, Mary Jo AQ. I love Father Martin, and I thought that exact thing just the other day. So Maureen Matheson or Matthews, thank you for saying you love the Sunday paper, Labor of Love. I hope all of you who maybe don't know about the Sunday paper, sign up for the Sunday paper. It's free and it's inspiring, I hope. People who sign up for it seem to love it. And so I hope maybe you'll think about signing up for the Sunday paper or following it. You're coughing. Yes, I'm fine. I'm fine. Dolly Parton. Yes, I'd love to do. What about Patrick interviewing you? No, I don't think so. Maybe at the end, when this is all over, Patrick and I will interview each other about what it has been like to live together. I actually woke up thinking that I've so loved living together again that I'll be sad actually when he leaves and goes back to his house. Yeah, I'll actually be sad when our home together is over. Anyway, okay, I'm going to leave you on a happy note. It's Holy Thursday. Tomorrow is Good Friday, which is not really a happy day in the Catholic Church, and certainly my memories of that as a child were not happy. But then there's Easter Sunday, which is a day of resurrection and a day to rise. And on Saturday, we do these conversations on Patrick's platform. It's called The Rookie and the Vet, Small Business Saturdays. And he's going to be doing that on his account, which has way more people than this account. So we can all come together and be in one big giant home together account. So on Saturday, we'll go over to Patrick. We'll see you here tomorrow with Vivek Murphy about loneliness and Sonia Sotomayor. Very good idea. Very good idea. Resurrection. So we're all, Hoda was calling me. So I'm going to go talk to Hoda and I will see you back here Good Friday tomorrow. All right. God bless you and have as good a day as you can. See you later. Bye-bye.